Content is user-generated and unverified. Every year, doctors diagnose hundreds of thousands of people with serious heart disease, and in a striking number of those cases, when specialists later look back at the patient's history, the very first warning sign never appeared in the chest at all. It appeared in the feet, months or even years earlier, quietly, without anyone connecting the dots. Here's a number I want you to remember: 1 in 3. That's roughly how many people over 60 with early-stage peripheral artery disease, a condition tightly linked to heart attack and stroke risk, have no idea they have it, according to vascular research. No chest pain, no shortness of breath, just a quiet, easy-to-miss sign in their feet that they mistook for normal aging. Today, I'm going to show you that sign, one specific, visible change in your feet that vascular specialists say can appear years before a cardiac event ever happens. And I'll walk you through 3 other related signs that together paint a much clearer picture of what's happening inside your circulatory system. Stay with me until the end, because the main sign we're covering today is one that almost everyone assumes is simply getting older, until they learn what it can actually mean. And by then, it's often already been present for quite some time. Your feet sit about as far from your heart as your circulatory system reaches. That distance is exactly why they matter so much diagnostically. When narrowing or hardening begins in your arteries, the early stages of the very same disease process that eventually leads to heart attacks and strokes, the smallest, most distant blood vessels are very often affected first, simply because they sit at the end of the line, furthest from the pumping action of your heart. Reduced blood flow tends to show up in your feet before it shows up anywhere else in the body, precisely because your feet are the last stop your circulation has to reach. This is exactly why vascular specialists sometimes describe the feet as an early warning system for the entire cardiovascular network. Quiet, easy to overlook, and often dismissed as just circulation or just getting older, when it may actually be one of the earliest visible signals of a much larger cardiovascular story still unfolding beneath the surface. Let's break down what's actually happening, slowly and clearly, because understanding this mechanism is what makes everything else in this video make sense. The condition we're talking about is called peripheral artery disease, or PAD. It develops when fatty deposits, the same kind of plaque involved in coronary artery disease, the disease responsible for most heart attacks, gradually build up along the walls of arteries that supply blood to your legs and feet. As this plaque steadily accumulates over months and years, the arteries narrow, and less blood and oxygen reach the tissue furthest from your heart. Your feet, sitting at the very end of your circulatory system, are often the first place this reduced flow becomes visible to the naked eye. Here's the part that makes PAD so significant, and not just a foot problem. Research has consistently shown that people with PAD carry a substantially elevated risk of heart attack and stroke, because the same arterial narrowing process affecting the vessels in your legs is very often happening at the same time in the vessels feeding your heart and brain. It's simply detected in your feet first, because that's where the earliest visible symptoms tend to surface. Your feet, in this context, aren't just your feet. They may be functioning as an early messenger for what's happening in arteries you can't see and would otherwise have no way of knowing about. This connection isn't new or speculative. Population studies, including data referenced by the American Heart Association, have found that a substantial proportion of people diagnosed with PAD are also independently found to have significant coronary artery disease, even when they've never once reported chest symptoms. The genuinely concerning part is how frequently PAD goes undiagnosed in the first place, because early symptoms are subtle and easy to attribute to arthritis, poor circulation from sitting too long, or simply the ordinary process of aging. Many people live with the condition quietly for years before it's ever identified, often only after a cardiac event brings them to a hospital for a completely unrelated reason. This is exactly why vascular specialists increasingly emphasize that changes in the feet shouldn't be dismissed reflexively, especially after age 60, which is precisely the age range where both PAD and coronary artery disease risk begin to rise together. If this connection is so well established, why do so many everyday people miss it entirely? A few honest reasons. The signs develop gradually, unfolding over months or years, so they're easy to normalize. Your mind quietly adjusts without you ever consciously registering that anything has shifted. Early PAD symptoms are often painless or only mildly uncomfortable, which simply doesn't match what most people expect something being seriously wrong is supposed to feel like. And foot health isn't part of routine heart checkups. A standard cardiac workup focuses almost entirely on the chest, blood pressure, and cholesterol, and feet rarely come up in that conversation unless you specifically bring them up yourself. If you're finding this kind of research-backed, practical information valuable, this channel publishes a new video like this every single week. No supplements, no hype, just the science translated into something genuinely useful. Consider subscribing so you don't miss the next one. Now here's the sign I promised you at the very beginning. When blood flow to the feet is reduced gradually over time, the skin and surrounding tissue in that area receive less oxygen and fewer essential nutrients than they need to maintain normal, healthy function. Two specific visible changes commonly result. First, the skin on the lower leg and foot can become noticeably smooth, shiny, or unusually thin in appearance, since reduced circulation directly affects the skin's natural ability to renew and repair itself. Second, and this is the change most people specifically overlook, often for years, hair loss on the lower legs and across the tops of the feet. Hair follicles require a steady, consistent blood supply in order to function and produce new growth, and when circulation to that area declines, hair growth can slow down considerably or stop altogether, sometimes leaving the lower legs looking distinctly smoother, balder, or more bare than they used to appear even a few years earlier. Most people who notice this kind of change simply assume it's an unremarkable part of the aging process, and to be entirely fair, some degree of natural hair thinning genuinely does occur with age, in men and women alike. But when this thinning is specifically concentrated on the lower legs and feet, rather than distributed more generally, and when it's paired with that smooth, shiny quality of skin in the very same area, vascular specialists consider it a meaningful pattern that's genuinely worth mentioning to a doctor, not because it represents an emergency, but because, taken together, it can serve as an early, visible signal of reduced blood flow that would otherwise go completely unnoticed. A second sign worth watching for, and one that's often noticed but rarely mentioned to a doctor, if one foot consistently feels noticeably cooler than the other, or if both feet feel unusually cold compared to the rest of your body, even in a warm room where you feel perfectly comfortable otherwise, it can reflect that same underlying reduction in blood flow. This is meaningfully different from the ordinary cold feet many of us experience from a cold room or thin socks. The specific pattern vascular specialists look for is persistent, disproportionate coolness, and especially when it's asymmetric, meaning one foot is noticeably colder than the other, since that asymmetry points much more specifically toward a localized circulation issue rather than a general sensitivity to cold that would typically affect both feet equally. A third sign, and one vascular specialists generally consider more urgent, small cuts, blisters, or sores on the feet that seem to take an unusually long time to heal or that don't appear to be healing at all, even after a couple of weeks have passed. Healthy circulation is absolutely essential for proper wound repair, since healing tissue depends entirely on a steady, uninterrupted supply of oxygen and nutrients delivered through the blood. When circulation to that area is compromised, even minor, everyday injuries can linger far longer than expected, and in more advanced cases, can progress into a serious concern requiring prompt medical attention. This is generally considered the sign with the least room for a casual wait-and-see approach among everything we're covering today. A foot wound that hasn't shown real improvement after roughly 2 weeks is genuinely worth having examined, particularly for anyone over 60 or anyone who already carries other cardiovascular risk factors. The fourth sign follows a very specific, well-documented pattern that doctors call claudication, cramping, aching, or a heavy, tired sensation in the calf muscles that reliably appears after walking a certain distance and then noticeably eases with a few minutes of rest. Here's why this happens. Working muscles require considerably more oxygenated blood than muscles at rest, and when the arteries supplying your legs are narrowed by the same plaque buildup we discussed earlier, the muscles simply can't receive the extra blood flow they need to keep up with physical activity, producing a cramping sensation that gets progressively more uncomfortable the longer you continue walking. This symptom is very often mistaken for ordinary muscle fatigue, arthritis, or simply being out of shape. The distinguishing feature vascular specialists specifically look for is the predictable, repeatable pattern. Discomfort that reliably shows up at a fairly consistent walking distance, resolves with a few minutes of rest, and then returns again once walking resumes. To be clear about something important, noticing one of these signs doesn't automatically mean you have heart disease, and it's genuinely not something to panic over. Circulation naturally changes somewhat with age for everyone, and many of these signs have other, entirely less serious explanations as well. But if you notice smooth or shiny skin paired with hair loss on your lower legs, a foot that's persistently cooler than the other, a wound that isn't healing on the schedule you'd expect, or calf cramping that follows a predictable walking and rest pattern, and especially if more than one of these applies to you at the same time, it's genuinely worth having a direct conversation with your doctor. Mention it specifically, by name, and ask whether it's worth checking your circulation, which can often be done through a simple, completely painless test called an ankle-brachial index, which compares the blood pressure measured at your ankle to the blood pressure measured at your arm. The whole test typically takes just a few minutes in a doctor's office. Let's bring everything together because we've covered quite a bit of ground today. Your feet sit at the very far end of your circulatory system, which is exactly why reduced blood flow often becomes visible there first, before anywhere else in the body. Sign 1. Smooth, shiny skin and hair loss, specifically on the lower legs and feet. Sign 2. One foot persistently cooler than the other, especially when the difference is asymmetric. Sign 3. Cuts or sores on the feet that heal unusually slowly or don't heal at all. Sign 4. Calf cramping with walking that reliably eases with a few minutes of rest. Together, these signs can point toward peripheral artery disease, a condition closely and repeatedly linked to heart attack and stroke risk, especially after age 60. This is exactly the kind of subtle, easy-to-dismiss detail that a simple, painless test can clarify completely, but only if you know to bring it up with your doctor in the first place. If this was useful, think about someone in your life over 60 who might benefit from knowing this. A parent, a spouse, a friend who's mentioned their feet feeling different lately without thinking much of it. Share this video with them, not to alarm them, just to give them the same information you now have. Subscribe for more videos like this, breaking down the subtle signs your body gives you long before a diagnosis does. And if there's a specific sign or symptom you'd like covered next, leave it in the comments. This channel's topics are often built directly from what you ask. Everything in this video is intended for educational and informational purposes only. It is not personal medical advice, a diagnosis, or a treatment recommendation. If you notice any of the signs discussed in this video, consult your physician for a proper evaluation. Only a healthcare professional with access to your full medical history can determine what these signs mean for you specifically.